Hello, on behalf of Hope Worldwide Australia, I'd like to give this brief update on the COVID-19 response across the South Pacific and Australia region. Many people have now been in lockdown for about a month, and our first case of coronavirus hit the Australian kind of shores about 12 weeks ago, so 4 months. And we're looking at about another month of lockdown to go. I had the opportunity of working in an emergency department in a rural hospital this last week, and it was busy. I think one of the things that was apparent was just the amount of time taken if someone suspected of having a coronavirus infection was the gowning up, the processes of putting everything on, seeing the patient, maybe doing the swabs, and then actually degowning again, and then going on to continue. And then if you had to go back to see the patient, you do the same process. So I could see even if we had 2 or 3 more patients that we needed to do all at the same time, then it would overwhelm the system. Other people would be then sort of having to wait to see the doctors. So fortunately the numbers are still not too high. Another observation I made working over the weekend was just the amount of people who are suffering with depression and anxiety. And in actual fact, we had 6 people that we had to keep in the hospital overnight because of suicidal sort of ideation and risk to harm themselves. And I think what was surprising was the youngest of these was 12 years old. So again, the situation has posed challenges on mental health. What is encouraging is to see what the Hope reps around the region are doing. Especially encouraging is to hear personal stories. I was talking to Joe Donato and a few others just about people serving, going out, meeting the needs in their communities. Specifically hearing about the Kings, Chris and Janice King, who actually through Facebook heard about a backpacker who lost his job, didn't have anywhere to stay, couldn't actually go back to Belgium, and they took him in. And so now he has a place to stay, is fed, and had his own temporary family. What was also interesting about the Kings is they have their own health issues, they're in their 60s, and yet they still have that sort of willingness to want to help others in the community. In fact, they're going out weekly to cook meals for people in their community, as well as drop-off items of groceries and things that people need. So I really just want to encourage us to have that same kind of serving attitude and heart, and really just to do what we can to help others. Thanks for listening.